Welcome back again. Before we go into the in-depth discussion about the NHS jobs website, I want you to understand the different levels of doctors that work in the NHS or work in the UK. So to tell you the levels of different doctors in non-training, we have to understand the different levels of trainee doctors as well, because the non-trainee levels are easily understood by the training grades. So say we start from medical graduation. So if you are a medical graduate, after you finish your medical college, in UK, you start foundation training. So that equals to internship back in our home countries. So in internship, we pass only 12 months. Here in the foundation training is 2 years. Even though it's 2 years, but the foundation year 1 is the pre-registration, foundation year 2 is the post-registration. That means the UK graduates gets the full GMC registration after the foundation year 1. So if we're talking about an international medical graduates who completed internship, they can get full GMC registration. So foundation year 1 is equal to the internship which you have completed already if you have full GMC registration. Then comes the foundation year 2. After foundation year 2, the UK graduates get into the core level training or GP training. So the core level training is separate for different specialties. Like for example, for medical specialties, the core level training is called internal medicine training. For surgical specialties, the core level training is called core surgical training. So say for surgical specialties, if we talk about different surgical specialty like say general surgery, urology, all those needs the core level training done first. So the core surgical training, then the internal medicine training. So I was talking about different levels of doctors. Yeah, let me stick to the point. So the internal medicine training is 3 years, is IMT1, IMT2, IMT3. It could be 2 years as well for different specialties. So you understand the CT1 or CT2 level are the core trainee level, but you will also hear some levels called ST1 and ST2. What are those? They're the similar level of the CT1 level. So why they're called ST1 and why they're called CT1. So CT1 is the core trainee and ST stands for specialty training or specialist training. So some of the trainings does not have separate core level training. So their training after foundation years starts directly from ST1. Say for example, pediatrics, it's a run through. So pediatrics doesn't have a CT1 because pediatrics core trainee does not exist separately. So the entire trainee starts from ST1, ST2 to ST7 or ST8, how far you go. So ST1 is technically at similar level as CT1. And for say other trainings which require the core level to be done first, they don't have ST1. Like you will not find a cardiology ST1 because cardiology ST1 is supposed to be the IMT1. So they finish the internal medicine training and then they start cardiology from ST4 now. So there will be no cardiology ST2. There will be the cardiology training will start from ST4. So all this is about understanding the different levels. So somebody who is at ST3 level is expected to done with the core level training. Somebody at ST5 level obviously have expected to done with the core level training. So the higher you go up, that means you have to have that amount of competencies or you're expected to work at that level. So the CT1 and ST1 is understood. So if you are applying for some job at ST1, which is essentially the same as CT1, the terminology differs because of the difference of specialties. So to cut a long story short, the different levels of doctors needs to be understood well enough, and we have a good flowchart explaining at what level of experience you can apply for what level of non-training job. Please go through that, and if you don't understand anything, you can always comment below. We're always here to help.